Talking about the anatomy of the pancreas. So I will be talking about the parts, relations, blood supply, lymphatic drainage, applied aspects. So this is a pancreas. It is a gland that is partly exocrine and partly endocrine. The exocrine part secrete the digestive pancreatic juices, whereas the endocrine part secrete hormone, glucagon, insulin, and many more. So it is a soft, lobulated, and an elongated organ. So it is about its location. So the pancreas, it lies transversely across the posterior abdominal wall at the level of the first and the second lumbar vertebrae. So it is a J shaped or retort shaped as it is set obliquely. It is about 15 to 20 centimeters long and 2.5 to 3.8 centimeter wide, that is approximately 3 centimeter wide, and 1.2 to 1.8 centimeter thick. It actually weighs around 90 gram. So the pancreas, it is divided it can be divided into head, neck, body, and the tail of the pancreas. So the head is enlarged and lies within the concavity of the duodenum, whereas the tail reaches to the hilum of the spleen. Now, above the head of the pancreas, the head is the enlarged, flattened right end of the pancreas, situated within the C shaped curve of the duodenum. The external features of the head are the head has, so it is actually having one process. This is the uncinate process. Three borders, a superior border, inferior border, and a right lateral border, two surface, anterior surface as well as a posterior surface behind it. Now about its relation. So talking about the relations, it has three borders. So one is a superior border. The superior border, it is overlapped by the first part of the duodenum and it is related to the this artery, that is the superior pancreatico-duodenal artery, whereas the inferior border, it is related to the third part of the duodenum and the inferior pancreatico-duodenal artery. So that is this artery, inferior pancreatico-duodenal artery. Then we have the right lateral border. It is related to the second part of the duodenum, the terminal part of the bile duct. So actually the bile duct will be coming like this and will be opening into the second part of the duodenum. Actually this bile duct, it joins with the pancreatic duct to form the hepatopancreatic duct. So the bile duct, it is related to the right, the terminal part of the bile duct, it is related to the right lateral border. And also the anastomosis between the two superior pancreatico-duodenal artery. We have the anterior and the posterior one. So this will anastomose at the right lateral border. So it has two surface. One is the anterior surface. So it is related from above to downward. So above, it is the first part of the duodenum. Then you have the transverse colon. The transverse colon will be in front. It is actually cut in this diagram. Then you have the jejunum. On the posterior surface, you have, this is the inferior vena cava, which will be going like this, and you have the bile duct. So this is a bile duct and the right crux of the diaphragm, and also the terminal part of the renal vein, because this is the kidney, and from the kidney the vein arises and joins with the inferior vena cava. So the terminal part of the renal vein will be related to the posterior surface. So then about the uncinate process, which is located behind the superior mesenteric vessels. This is the superior mesenteric vessels. So this is the aorta. The superior mesenteric vessels is actually located in front of the uncinate process, and behind this uncinate process there will be aorta. So now about the neck of the pancreas. It is slightly constricted part of the pancreas between the head and the body. It is actually directed forward, upward, and to the left. It is actually having two surfaces, an anterior surface as well as posterior surface. So the anterior surface is related to the peritoneum covering the posterior wall of the lesser sac and the pylorus of the stomach. Actually here there will be the stomach. Actually the stomach has been cut to show the pancreas. So it is actually behind the neck of the pancreas. The superior mesenteric vein, which is coming like this, it joins with the pancreatic vein to form the portal vein. So the portal vein formation happens here. So next, about the body of the pancreas, it is actually elongated and it extends from the neck to the tail. So the external features of the body of the pancreas. So when you are taking a cross section of this section, you will get a triangular shape. It actually has three borders. That is a superior border, inferior border, and an anterior border. And here you can see that a part of the body, it actually projects upward beyond the rest of the superior border, and this projection is called the tuber omentale. So the anterior border, it actually provides attachment to the root of the transverse mesocolon. So the superior border is related with the tuber omentale, and the inferior border, it is related with the superior mesenteric vessels. So the body of pancreas have three surfaces, an anterior surface, a posterior surface, as well as inferior surface. So the anterior surface, it is concave. It is directed forwards and upwards. Actually, it is related to the lesser sac and the stomach, because the stomach will be here. Whereas the posterior surface, which is present behind it, there is no peritoneum, and it is related to the aorta. Then there will be the left crux of the diaphragm. Then we have this is a left kidney. So the left kidney is present behind, and there will be left renal vessels. Now above the inferior surface, it is covered by peritoneum, and it is related to the duodenojejunal flexure. So this is a duodenum, and this is a jejunum. So the duodenal jejunal flexure and even the left colic flexure. So this is the tail of the pancreas. This is the left end of the pancreas. It actually lies in the lieno-renal ligament together with the splenic vessels. It comes in contact with the, actually this tail of the pancreas is coming in contact with the inframedial part of the gastric surface of spleen. The exocrine pancreas, it is actually drained by two ducts. One is a main pancreatic duct, that is the duct of Wierson, and the other is the accessory pancreatic duct of Santorini. So the main pancreatic duct, it is 3 mm in diameter, lie near the posterior surface of the pancreas, and it is recognized by its white color. It receives many small tributaries which join. You can see that it is receiving many small tributaries joining at acute angle, showing a V-shaped pattern. So this is a V-shaped pattern. That is called a herringbone pattern. So within the head of the pancreas, the pancreatic duct, it is related to the bile duct. So the two ducts enter the second part of the duodenum and join to form the hepatopancreatic duct through the ampulla of Vater. The accessory pancreatic duct, it begins in the lower part of the head of the pancreas. It crosses the front of the main duct. Actually, it is crossing at the front of the main duct and it is opening into the duodenum through minor duodenal papillae. Now talking about the arterial supply. So the pancreas is supplied mainly by the pancreatic branches from the splenic artery, then from the superior pancreatico-duodenal, and this is the inferior pancreatico-duodenal artery. Inferior pancreatico-duodenal artery is coming from SMA, superior mesenteric artery, whereas superior pancreatico-duodenal artery, it is coming from the celiac trunk. So the veins drain into, this is a splenic vein, superior mesenteric vein, and to the portal vein. And the lymphatic drainage is the pancreatico-splenic lymph node, celiac lymph node, and the superior mesenteric lymph node associated with their arteries. Now about the nerve supply of the pancreas. So parasympathetic is by the vagus nerve, and there is sympathetic is by splanchnic nerves. So talking about the function of the pancreas, it is having digestive function, endocrine function, and it secretes pancreatic juice. So this pancreatic juice, it make the alkaline pH for the action of the pancreatic enzymes. Endocrine means it is actually secreting glucagon, insulin, and many other hormones. So pancreatic juice contain many digestive enzymes. The trypsin, which break down the proteins, then it secretes amylase, lipase. Talking about the applied, so the deficient one is the diabetes mellitus, a deficiency of insulin. Then there the carcinoma of head of pancreas. Then about the cyst forming in the pancreas, pancreatitis. So altogether we can say that the pancreas is a retroperitoneal organ except the tail. The tail is only covered by the peritoneum. The maximum islets of Langerhans is present in the tail of this pancreas. When there is carcinoma or the cancer at the head of the pancreas and periampullary tumor, there will be, this is a bile duct, common bile duct, and here there will be pancreatic duct. So there will be simultaneous dilatation of these two ducts, and in X-ray we can see as double duct, and this sign is called double duct sign. So what is a Passaro's triangle or the triangle of gastrinoma? So it is a triangle formed by 3 points. So one point is taken at the junction of the body of the pancreas with head and neck. That is, one point is taken here. Second point is taken at the junction of the cystic duct with the common bile duct. And the third point is taken at the junction of second and the third part of the, this is the second part of duodenum, this is the third part of the duodenum. At the junction, the third point is taken. So we can draw a triangle. So this triangle is called a Passaro's triangle, or also known as triangle of gastrinoma. So that's all.